Hi class, welcome to chapter 14, Water and the Major Minerals. I'm still a little under the weather today, so I'll do my best to make this as clear as possible without having to cough or pause too many times. So this is from your book, and I mostly agree with it. You can think about some of the nutrients our body needs as far as the rule of threes. In theory, we could go 3 weeks without food, 3 days without water, and 3 minutes without air. And of course, this will vary based on individual nutrient status, especially with regards to food. There have been people who have gone much, much longer with this in situations of extreme famine and starvation and even intentional fasting without food. And come out on the other side. However, water and air, we don't quite have the wiggle room for. So it's very important that we have adequate water every day, and obviously adequate air really every minute, every second of our lives. So we're going to talk a little bit about fluids today, and we're going to talk about intracellular and extracellular fluids. Hopefully you remember from some of our introductory chapters that our bodies are made primarily of fluid. And so by weight, our bodies weigh more in fluid than any other component. People have different amounts of fluid depending on gender and lean muscle percentage in their bodies. So people who have more lean muscle actually have more fluid in their body because lean muscle is about 73% fluid as compared to people who have higher concentrations of adipose tissue, which is about 20% fluid. So somebody who is more muscular, which typically happens in males, end up having a higher percentage of body fluid than somebody who might have a higher distribution of body fat, as in females. And I'm not saying that all females are fatter than males, but generally men have more body water than women, and anybody more muscular would have more water than somebody more obese. Water can be broken down into 2 different compartments, like I mentioned, intracellular and extracellular. And intracellular is kind of what it sounds like. It's inside the cells. And this is where 2/3 of our water can be found. Extracellular is outside of the cells and is made up of interstitial water and intravascular water. This is what is this called? I can't remember, a graduated flask perhaps, but this is looking at total fluid in our body and dividing it up into intracellular fluid and extracellular fluid. You can see the majority of fluid in our body is intracellular, meaning inside the cells. So that would include blood, bone, muscle, and adipose cells. Extracellular fluid makes up about just over 1/3 of the fluid in our body, and extracellular fluid can be broken down into intravascular, which involves our blood and the lymph, and interstitial, which is the fluid between the cells, gastrointestinal fluid, spinal fluid, fluid in the eyes, tears, synovial fluid, etc. Some of these fluids, especially the extracellular fluid, are not 100% water, and they do contain dissolved particles. These are some of the examples of just some of the dissolved particles that are in these fluids, and these particular ones are called electrolytes. And they're called electrolytes because they carry charges. Some of them that we're going to be talking about today include sodium, chloride, potassium, and phosphorus. Fluid balance. So it's very important to maintain fluid balance for adequate health and well-being. And it's important to balance the amount of water inside and outside the cells. There's very, very delicate balance here. This is maintained via pumps on the plasma membranes, and the pumps work to pump electrolytes into and out of the cells. The electrolytes include sodium, potassium, chloride, phosphorus, etc., and the ions in water that are capable of conducting a current. Some of the action of the pumps involve pumping potassium into the cell, sodium out of the cell, and this goes against a concentration gradient using energy. Water can also move via osmosis, and osmosis does not require energy, and water will move via osmosis when water follows concentration gradients. So water will move from an area of a high concentration gradient to a low concentration gradient. From a low concentration gradient to a high solute gradient, meaning, for example, from something less salty to something more salty. This is mostly a FYI diagram, but this is a picture of the sodium-potassium pump and how sodium and potassium ions are pumped into and out of the cells, and how ATP is broken down in this process. So you can review this in more detail in your text. This is a picture of different situations involving osmosis, and remember, osmosis does not require any energy. The action of the sodium-potassium pumps does, but osmosis doesn't. If a cell is in a hypotonic solution, that means that the solution is less concentrated than the cell. There are less dissolved particles or ions in that solution. And because water will flow from low to high concentration gradients, water will flow from the solution into the cell, and this can actually cause the cell to swell and burst. In an isotonic situation, the concentration gradients in the cell and the water are the same, and so there's no change in water flow. The volume inside this beaker is the same as the volume inside the cell, and nothing is swelling or shrinking or bursting. In a hypertonic solution, the solution in this particular beaker is more concentrated in electrical charged solutes than inside the cell. And so remember, water will flow from low to high concentration gradients, so water will flow out of the cell and into the solution, and this causes the cell to shrink. Both cell shrinkage as well as cell expansion and cell bursting can inhibit cell activity and actually destroy the cells. Functions of water. So what does water do for us? So many things. We're going to talk about some of these in more detail coming up. But it maintains our blood volume, it helps transport nutrients, it helps make all these important fluids that we have: bile, saliva, amniotic fluid, tears, GI juices, etc. Helps form lubricants, for example, in our joints. It serves as a solvent in metabolic processes, and it helps in chemical reactions such as hydrolysis. Remember, hydrolysis reactions are reactions where water is added and molecules can be split apart. For example, disaccharide molecule of 2 sugars can undergo a hydrolysis reaction to become monosaccharides. Water is also very important to regulate temperature, and this is a picture of somebody sweating. I'm sure all of you have experienced this before, but what happens in sweating is our body releases water to the surface of our skin, and when that water evaporates, it serves to cool us down. Water is a very important molecule as far as temperature maintenance because water is very kind of resistant to changes in temperature. And this can be especially noticed when you think about boiling water versus, say, putting some oil in a pan. If you put some oil in a hot pan on the stove, that oil heats up very quickly. Where if you put water in a hot pan on the stove or, say, in a pot to boil it, it takes quite a long time. This helps protect our body from great fluctuations in temperature because it's hard to break down this water molecule. Water also helps us get rid of wastes via the urinary tract and urination, and so it's a medium to get rid of these wastes that we produce, such as urea. Generally, we urinate 4.5 to 8.5 cups a day, but this will depend on what we have intaken, meaning drinking or consumed, as well as our kidney function. Where do we get water? So obviously we can get water from water, but we can also get it from anything that's moist. So this would include juices, milk, soups, popsicles, puddings, jello, juicy fruits, fresh vegetables. Even things like bread contains water. Butter does not have that much, but even things like jam. So any food that has any sort of moisture whatsoever contains water and contributes to our daily water intakes. How much water do we need? So needs are not the same for every single person involved, and needs will vary based on your body size, your physical activity, your environment, and your dietary intake. So people who are larger are going to have greater needs for water than people who are smaller. If you are being very physically active and, say, sweating a lot, you're going to need to replace that water more quickly than somebody who's sedentary. If you're in a hot or humid environment where you're sweating a lot and that sweat isn't actually functioning to cool you, you're going to be needing to replace water more rapidly. And depending on your dietary intake, whether you're eating lots of watery type foods or you're not, that could vary your water requirements as well. Generally speaking, adequate intake for men and women are 15 cups for men and 11 cups for women. And this doesn't have to be 11 cups of actual water or 15 cups of actual water, but that would be total fluid intakes during the day from all sources. So these are some of the places where we get water. Obviously, we drink water. We can get water from foods that we eat. However, our body actually produces water. So if you remember, this is a picture of the mitochondria. During some of those reactions in the electron transport chain, water is actually produced. So we actually make our own water. We have to get rid of some of that water. How do we get rid of the water? We can sweat. When we breathe, if you've ever seen your breath on a cold day, you can see your breath because it contains water vapor in it. In our stool, in our urine. Those are ways we can get rid of our water. Insensible losses are losses that we don't necessarily, that aren't as obvious to us, and sensible losses are losses that are pretty obvious to us. How do we regulate body water? So the organ that is most important to regulate fluid balance is the kidney. And the kidneys help filter all of the toxins in the blood, as well as concentrate the urine, and the kidneys feed directly into the bladder and excrete urine. If you are dehydrated, this will cause your blood pressure to fall, and it will cause your body to conserve water. So what your body will do to do that is to release something called antidiuretic hormone. And antidiuretic hormone will cause you to reduce your urine output because you want to conserve water. You'll reduce your urine output as well as constrict your blood vessels, and this will help bring some of your blood pressure back up if you're dehydrated. Other signs of dehydration and other causes of dehydration. So sometimes you can tell if you are dehydrated based on the color of your urine, but not always, because some dietary factors may affect the color of your urine. But generally, clear to very, very light urine and copious urine is considered well hydrated, with darker urine and low amounts of urine would be considered poorly hydrated. Other symptoms you might feel: dry mouth, fatigue, headache, dizziness, reduced blood pressure, kidney failure, heart rate increases, kind of drying out of your mucous membranes, like having kind of a cotton mouth, or even feeling like your eyes are really dry, seizure, and even death. And often dehydration can be due to not drinking enough water, but it could also be to losing too much water. Say you had really bad diarrhea or vomiting, or you're hyperventilating, or the weather's really hot, or you had a burn. Those could also contribute to water losses. Can you have too much water? The answer is absolutely yes. So you can have too much water, and the reason that this can cause a problem is because if you're drinking water and only water, it can actually dilute some of those important electrolytes in your body. And cause something called water intoxication. So this is generally a problem in athletes. Say if an athlete is exercising a lot, sweating a lot, and they're losing water and electrolytes on their skin through their sweat, but they're only replacing the water, what electrolytes they have left circulating in their bloodstream end up being quite diluted. And this can actually cause water toxicity. It can cause muscle cramps, low sodium levels, respiratory arrest, convulsion, and even death. So oftentimes endurance athletes or athletes who might be sweating a lot should be consuming something like a sports drink or an electrolyte drink. All right, so we've discussed water, and now we're going to discuss some of the major minerals. The major minerals are essential to us. They're inorganic elements found on the periodic table of elements, and we need them in small amounts for function, growth, and maintenance of tissues. They're considered the major minerals because we need them in over 100 milligrams a day, and they're stored in larger quantities of the body. We're going to focus today on sodium, potassium, calcium, and phosphorus, and we may briefly touch on magnesium and chloride, but it also includes sulfur, which we will not touch on that much. The minerals are considered essential because we cannot make them in our bodies, so we need to obtain them through our diet. All right, so this is a chart looking at the major minerals versus the trace minerals, and we will be talking about the trace minerals in future chapters. You can see that calcium of all the minerals is needed in the highest amounts in the human body. Where do we get minerals? So mineral content in foods can vary based on very many things. It can depend on where the food comes from, if the food has been fertilized, if the soil has been fertilized, if the soil was nutrient rich, if the soil was nutrient poor, where the plants were grown, where different animals were fed, what different animals were fed, or if any minerals were added back during the processing. Absorption and bioavailability. So many factors influence how we absorb these minerals, and some of them are our own factors, and some of them are factors found in the food sources themselves. So physiological need influences our ability to absorb minerals, and generally our body has some really tight checks and balances that allow us to absorb more minerals when needed and not absorb as many when we have sufficient quantities in our body. There are some biological factors, both intrinsic to humans and then also extrinsic coming from the environment, that affect bioavailability as well. Generally, having good stomach acidity, vitamin C intake, and good vitamin D status can help with bioavailability. If you have poor gastric acidity, meaning your stomach is not acidic enough, if you're eating foods that are high in phytic acid or oxalic acid, that can reduce absorption, or polyphenols, or high doses of supplements. Phytic acid is found in wheats, legumes, and fibers, and actually can bind the minerals and reduce their absorption. Oxalic acid is commonly found in leafy greens, and again, it also binds some of these minerals and reduces their absorption. What are some of the functions of these minerals? We're going to be talking about each of them specifically on the next slides, but they play roles in water balance, nerve impulses, as coenzymes, as different components of our body compounds, and they're important for growth and development. So the first mineral we're going to talk about is sodium. And in the American diet, we get a lot of sodium from salt. So most sodium in our diet comes from salt. And when I say salt, I mean salt that's been added to foods or in restaurants or at your table. But salt is not only sodium. Salt, as we know it, is sodium chloride. And so in a teaspoon of salt, we get about 2,300 milligrams sodium, which for most people is the upper limit. As far as most of the sodium in our diet comes from, it primarily comes from processed foods and restaurant foods, and this can account for about 75 to 80%. It's commonly found in cold cuts, cured meats, pizza, chicken soup, sandwiches, cheese, meat sauce, casserole type dishes, snacks, sauces, spreads, and dips. Processing significantly increases the amount of sodium in a food, and these are just some examples. For example, going from uncooked rice to fried rice increases the sodium by 703 milligrams. Going from a baked potato to potatoes au gratin increases the sodium from 10 milligrams to 788. If you're looking at baked chicken, naturally it's found to have 60 milligrams of sodium. If you eat that same portion of chicken as deli meat, it has 865 milligrams of sodium. So you can see that processing and cooking of these foods in different ways, preparing them in different ways, significantly impacts the sodium levels. And so therefore, eating fresh, mostly unprocessed foods can help reduce your sodium. How much sodium do we need? So as many of the dietary reference intakes do, it varies based on age. Tolerable upper level is 2,300 milligrams. Why the daily value is higher than the tolerable upper intake level, I have no idea. I don't agree with that at all. Most Americans consume way too much sodium. On average, men consume 4,243 milligrams. Women consume 2,980 milligrams. High-risk population should consume 1,500 or less. And anybody high risk could be considered African American, individuals with hypertension, diabetes, chronic kidney disease, anyone over age 51, or anybody who has family history of hypertension or heart disease, which if you think about the population, that's just about everybody. Excuse me. So why do we need it? We absolutely do need it, even though we consume too much of it, and it's kind of talked about as a bad nutrient. But it does play many important roles in our body. It's involved in glucose and amino acid absorption. It's important for nerve conduction and muscle function. There are electrical charges created by the sodium-potassium pump that we saw a little bit earlier in this slide. And it's important in water balance. It helps regulate extracellular fluid because it's the main solute in extracellular fluid. And therefore, when we eat more sodium in our diet, it actually causes us to retain more water, which isn't necessarily a good thing, but that's one of the outcomes. Deficiency. Generally speaking, deficiency is rare, but it can occur if somebody is sweating heavily or only replacing their water losses or their sweat losses with water and not an electrolyte drink. It can also occur in severe diarrhea or vomiting, especially in infants. Generally speaking, like I said, we consume way more than we need. And so everybody in general should cut down if possible. Excess sodium. So excess sodium is not good for us. It can lead to hypertension, otherwise known as high blood pressure, heart disease, and stroke. It can cause calcium losses in the urine. It does cause some calcium losses if you consume over 2 grams a day sodium. However, these calcium losses are not associated with osteoporosis. So I guess what that means is although we observe the calcium losses, we're not sure of their clinical significance. So far, we don't see a clinical significance with osteoporosis. Some states are taking salt very seriously, and New York, for example, actually has a salt warning that they've been putting on menus in different restaurants that have very, very high sodium entree options. Potassium. So potassium is very similar to sodium. However, if you wanted to say sodium was kind of the bad guy, you could say potassium was the good guy. It has many of the same effects, but unlike sodium, we don't get enough of it, and it can actually help reduce our blood pressure. Some of the sources of potassium, it's found in dairy, it's found in fruits and veggies, it's found in whole grains, it's primarily found in unprocessed foods. And the adequate intake level for adults is 4,700 milligrams per day. Most adults do not meet this level. Potassium is actually being newly added to the nutrition facts label, which should be out about the year 2020. And the reason it's being added is because it's shown to have positive health benefits, and we're not eating enough of it. So this will be something to strive to eat more of. Some of the functions of potassium, again, kind of similar to sodium. It's a major cation in the cell. It's positively charged. It's intracellular. It helps with fluid balance, transmitting nerves, contracting muscle. It helps maintain calcium in the body and reduce losses of calcium in the urine. So that's actually opposite sodium. It can help normalize the blood pressure effects of high sodium. When you have high potassium intakes, it actually causes sodium and excess water to be excreted, and that can help counteract some of the water retention that may occur with sodium. Deficiency can occur, and it's much more likely to have a deficiency in potassium than it is with sodium. Sometimes deficiency could occur in people with eating disorders, alcoholics, or athletes, or people who are using diuretics, which would make them urinate excessively, and some of them cause potassium loss, as well as laxatives, or anyone who has severe diarrhea or vomiting. You can consume too much. However, for the general public, this is not a problem because we're really good at excreting it. Consuming too much is generally only a problem for people with kidney disease, end-stage kidney disease, end-stage 4 kidney disease, which I happen to work with those people, and potassium can actually be deadly to them. I've had many, many patients go to the hospital because they can't excrete adequate levels of potassium, and it builds up. Since potassium is important in muscle contractions, it can affect all the muscles, but the most important one we're concerned about is the heart. And so extremely high or low potassium levels can cause heart attack. And interestingly, or scarily, they actually at times have used potassium injections to stop the hearts of people who were on death row. Next, okay, chloride. So chloride is Cl minus, and most of the chloride in our diets comes from table salt because remember, table salt is sodium chloride. Generally speaking, we get enough. It helps to balance fluid with sodium, it aids in nerve impulses, and it's important for stomach acid. And so we don't see deficiencies that often. Like I mentioned, we don't see deficiencies that often. Some of the same things that cause potassium and sodium deficiency could cause chloride deficiency. If you're vomiting a lot, you could be losing a lot of hydrogen chloride, HCl, and so that can cause chloride deficiency. And there is an upper limit for chloride. A little bit of a focus on hypertension. So hopefully you remember hypertension is high blood pressure, and it's estimated that 1 in 3 adults have high blood pressure. I would actually think that it's higher than this, but a lot of high blood pressure goes undiagnosed because sometimes people don't feel the effects. Optimal blood pressure is 120/80, and this is measured as the systolic blood pressure, which is the pressure in the arteries when the heart beats, over the diastolic pressure, which is the pressure in the arteries when the heart relaxes. In general, blood pressure is the force of the blood against the arterial walls. And they actually just came out with new blood pressure recommendations recently within the last month. So how does nutrition play a role, as well as lifestyle? So with older age, certain ethnicities, obesity and diabetes, you will have a higher risk of high blood pressure. And high blood pressure is directly correlated to risk of heart attack, stroke, dementia, kidney disease, and vision loss. High blood pressure is also associated with potentially some insulin resistance and some interesting facts. With obesity, 1 pound of fat requires an additional mile of blood vessels, and so the heart has to work harder with every pound of fat people gain. How do we help lower blood pressure? So some generally healthy tips are weight loss, even 10 pounds helps, limiting sweet, sugary drinks, red meat, eating more fruits, veggies, whole grains, being physically active, limiting sodium intakes, limiting alcohol, increasing some of these healthy nutrients like potassium, calcium, and magnesium, and fiber, and eating foods that have antioxidants or polyphenols. What does caffeine do? So in this little diagram, it says no caffeine, and this is kind of a question mark. Caffeine does increase blood pressure, but it's only acutely, and it generally only increases blood pressure about 5 to 10 millimeters of mercury. When I mean acutely, I mean it doesn't last forever. It generally only increases blood pressure for about 3 hours, and then the blood pressure falls. And in studies of caffeine, they have found that it does not damage the blood vessels. If you do have high blood pressure and you're taking a high blood pressure medication, you may be advised to limit caffeine because some caffeine may interfere with some of these high blood pressure medications. But generally speaking, it should be okay. And actually, people who consume 3 to 5 cups of coffee a day have lower risk of heart disease. DASH diet. So the DASH diet is dietary approaches to stop hypertension. And this particular diet is low in saturated fat, total fat, trans fat, cholesterol. It's high in fruits, veggies, low fat dairy. It's rich in magnesium foods. Those are leafy greens, potassium foods, calcium, and fiber. And it does not use supplements. And the DASH diet, depending on the level of sodium restriction in the DASH diet, there's actually a couple different levels, has been associated with reduced blood pressure numbers. So it is a significant and meaningful intervention. Different levels of sodium for the DASH diet might be 1,500 or 2,400, depending on which kind of arm of the DASH diet somebody was able to follow. Calcium. So everybody knows that calcium is found in milk, but it's also found in many other food sources. Can be found in tofu, salmon, beans, collard greens, turnips, and fortified cereals, as well as almonds. And calcium is very important for us. However, most people do not consume enough calcium. How can we improve our calcium absorption? There is a vitamin, it's a fat-soluble vitamin. Hopefully you remember that it's vitamin D, and specifically vitamin D3. Cholecalciferol can be converted to calcitriol and can help with calcium absorption. Additional dietary factors that may affect this include other minerals in the foods such as zinc, magnesium, and iron. So if you're eating foods that have high levels of zinc, magnesium, or iron, it's possible that your calcium absorption may be lower. Where is calcium stored? Hopefully you remember that calcium is stored in our bones for the most part. And so about 99% of calcium is actually in our bones compared to circulating in our blood. It's also in our teeth. What does it do? So it helps with our bones and teeth. I think many of you guys have been taught that since childhood. It's involved in blood clotting. Perhaps you didn't know that. Helps with nerve impulses, muscle contraction, and cell metabolism. And we'll talk about each of these coming up. In bone, it's combined with phosphorus to form something called hydroxyapatite, and this is kind of the basic matrix of bone. It helps with bone remodeling, breakdown, and building, meaning that bone can be kind of broken down and then built back up. And about every 7 years, the total calcium supply in your bones is kind of rotated, depleted, and exchanged with calcium in your bloodstream. So your bones are very dynamic and they're always changing. In middle age, you do lose more calcium from your bones than you put into your bones. And so for many people, their bone quality, bone strength diminishes. Women are especially at high risk because as estrogen levels fall, the balance of bone remodeling kind of changes and they're more likely to lose bone. So blood clotting, it's essential for blood clotting. It helps transmit nerves. I have a picture of that. Well, the book has a really good picture of that coming up, and it's important for muscle contraction. In the situation where you might not have enough calcium, something called hypocalcemia can occur, and hypocalcemia means low blood calcium levels, and this can cause tetany, which is literally kind of like a freezing up of the muscles. And what it is tiny, tiny muscle spasms because the muscles are getting continuous nerve stimulation and they can't relax. Sometimes this can be affected by something called parathyroid hormone, or PTH. Osteoporosis. So I'm sure many of you have heard of osteoporosis. Osteoporosis is weakening and kind of just a weakening of the bones, meaning the hard material that's in the bones becomes more holy, more sponge-like, and there's less of the solid bony matrix involved in the bones. Osteoporosis affects 9 million adults, and it can be due to low calcium intakes, high calcium losses, high calcium pulled from bones, but often it's due to a combination of these things as well as low attainment of peak bone mass. And people are achieving their peak bone mass right between age 20 and 30. So good nutrient intake as well as other dietary factors kind of, as you get up to those ages as well as during those ages is really key to increase your bone mass, because once you have reached those ages, your ability to accumulate bone mass declines and you'll never be able to meet that peak bone mass again. So this is a diagram of two different scenarios, and in scenario B, this is a person who did not achieve very high bone density between their 20s and 30s, and so when they were elderly, they already had osteoporosis, and they had this kind of curvature of the spine, this kyphosis, which is called a hump. Kyphosis is this hump. It's related to loss of bone in the spine and compression fractures in the vertebrae. In the other scenario, this person has achieved higher peak bone mass, 20s and 30s, and so then when they're an elderly person, they're not yet suffering from osteoporosis. Some of the risk factors for osteoporosis are genetics, small structure, low peak bone mass, as you can see here. Age, as you get older, higher risk. White or Asian ethnicities are at higher risk. Amenorrhea, meaning not starting or having regular or normal menstrual periods. Removal of ovaries, this can reduce estrogen production. Smoking, low calcium intakes, low vitamin D intakes, excessive alcohol, inactivity, some diseases, and some medications. And this is a picture of osteoporosis developing, as well as kyphosis, which is this kind of bump on the spine. And it can be due to wedged upper vertebrae and crushed lower vertebrae. Prevention of osteoporosis. So you guys, right now, eat healthy, do weight-bearing exercise. Make sure your diets are rich in calcium, magnesium, phosphorus, vitamin D, potassium, vitamin K, and protein. Don't smoke, eat less meat, less desserts, less fried foods, less alcohol, less sweetened beverages. Other potential benefits of calcium may help reduce risk of colon cancer. The evidence is slightly weak there. May contribute to reducing high blood pressure, and may reduce calcium oxalate kidney stones that are formed. Kidney stones. So I think a lot of people say, oh, kidney stones. I had a kidney stone. He passed a kidney stone. But what are these actual stones? There are many, many different types of kidney stones. You can look them up online if you want. They're kind of interesting and horrifying at the same time. But they're actually a mineral stone that has formed usually in your kidney, and then in order to get it out, you either have to do surgery, or it passes down through your ureter, which is the tract leading to your bladder, and that can be very, very painful. And it can block the ureter, it can cause infection, it can cause vomiting, pain, and just be very kind of debilitating. Upper level of calcium. So it is possible to consume too much calcium, but like I said, most people are not meeting their needs. The upper level is 2,500 for 19 to 50-year-olds, 2,000 for those over 50. And the reason there's an upper level is because it can lead to high calcium levels, hypercalcemia, which again in healthy people is pretty rare, or kidney stones. It may also cause headache, irritability, decreased absorption of other minerals because these all bind for similar sites, and potentially kidney disease. Phosphorus. So I put pictures of these foods, which are slightly blurry here, but just so you could see some sources. And we'll have more sources on the next page. But phosphorus is found in so many foods. It's found in all dairy foods. It's found in beans and nuts. And then I have a picture of soda. It's found in dark sodas and processed foods. Here you see it's found in protein foods. All protein foods do naturally contain phosphorus. It's found in pancakes. It's found in cookies. It's found in pizzas. It's found in beans. It's found in sunflower seeds. It's found in cornbread. It's found in corn tortillas. It's literally in everything. It's found in bottled waters even sometimes. And most people do exceed the RDA and the daily value for phosphorus. Functions. Phosphorus is important to bones and teeth. It does help make up that hydroxyapatite structure in our bones and teeth. And it's also found in all of our cells, if you think of our phospholipid membrane, as well as ATP. There's a phosphorus on ATP, adenosine triphosphate, DNA, RNA, as well as acid-base balance. So it's extremely crucial to many, many functions in our body, and most of us get enough phosphorus. Magnesium. So magnesium is generally found in green leafy veggies as well as other green veggies, broccoli, squash. It's found in beans, nuts, whole grains, and chocolate. And sometimes it's found in our water, depending on our water sources. Needs are listed here, and magnesium has many functions. Some additional sources. It is the second most abundant intracellular cation. It is important for ATP. It helps pump sodium out of the cells and potassium in, so it's a crucial part of that sodium-potassium pump. It's needed for DNA and RNA synthesis, nerve transmission, muscle contraction, glucose and insulin metabolism, and contributing to bone structure. So it's very, very important. And there's actually a growing body of evidence that is indicating that many people actually might be deficient in magnesium. If you are deficient, it can lead to some of these symptoms: weakness, muscle spasms, seizures, nausea, vomiting, etc. And there is an upper limit. If you exceed the upper limit, diarrhea can happen. And this is interesting to note because actually many over-the-counter products to help with constipation contain magnesium in them. For example, milk of magnesia. There's also something called MG Go. It's a magnesium supplement that can reduce constipation and promote looser bowels, etc. All right, that is all I have today. You can read a little bit about sulfur in your books, and I hope you enjoyed this lecture, and I'll talk to you soon. Thank you.